So I'm going to tell you guys a bit today about my professional experience. I was invited to give a talk about just what I've done throughout my career since leaving BLD. And I don't expect it to be long, about 15 minutes. But it's a bit of a winding road and includes a monkey. And I hope you guys find some insights kind of along the way. So my goals for today's talk, because it's important for me to set some expectations, I'm just going to give a brief professional summary. I don't think it's super relevant to talk very in depth about my professional experience. I'm happy to talk about the work I've done in depth offline or after, but this presentation is going to be mostly focused on the how and why I've made these changes. It's going to be a lot of pictures and maps, and I just want to give you guys some food for thought as you enter your professional journey and leave academics and such. So I thought I'd start with Michigan State since we all have that in common. I came to Michigan State in 2014, specifically for the BLD program because I wanted to be a doctor and I thought the BLD program would set me up really well for medical school. When I came to state, I had never even heard of epidemiology. I think the first time I heard about it was in Dr. Morris's mechanism of disease class and Dr. Downs' kind of assorted medical microbiology and parasitology courses. And it was a pretty hard realization for me when I realized that I liked diseases more than I liked people, and I didn't really want to be an MD anymore. But kind of at the same time, I was realizing that I wasn't very excited about becoming an MLS. I was way more interested in the mechanics of diagnostics, and I wanted to delve more into that. So Dr. Thorne, who I think is retired, recommended that I do an internship in Oakland, California at a reference lab. So I spent a summer doing research on von Willebrand's disease and basically fell in love. I loved research. I got to spend a summer designing assays and working with PhDs. And by the end of it, we had written an abstract and published it. And my work ended up being presented at a conference, which is really, really exciting. So when I graduated in 2018, I became a trader and I went to work at U of M. I was the senior lab tech and then the lab manager of Dr. Kurt Hakinson's lab at U of M. We did some pretty niche translational research of a cellular pathway focused on bone regeneration. The top left photo here of us at axe throwing is the size of the lab at peak when I was its lab manager. And I loved this job when I got there. I got to do a lot of really different things that I never expected to do. I worked with a lot of mouse models. I got to design my own assays, troubleshoot assays, collaborate with people all over the world. And I got to work with a lot of undergrads, which I really enjoyed. This bottom photo is me with my undergrad student team my last summer at U of M. And I also got to flex some presentation skills. I presented at conferences, wrote manuscripts, and it was just a really rewarding time. I learned a lot. But there's not really a better way of saying this. I got bored. When I started this job, I really thought I was going to get my PhD in bioengineering or in orthopedics. And then I don't know, I just got tired of running assays and it was too small scale for me. Everything that we were doing was really interesting, but it was research for research's sake. Everything that we studied and discovered was at minimum 10 years away from making it into to help a patient. And I think that was just too small scale for me. I also got really involved in work-life initiatives, developing programs to encourage healthy lifestyles and trainings to help people with recycling and climate change, things like that. And I found out that I was getting more fulfillment out of that side of my volunteer work than I was from my actual research. And kind of while all this is going on, I was still maintaining pretty active relationships with Dr. Downs, Dr. Morris, and Marianne Wolf, who were all from the BLD program. We would have coffee and they're very gracious. And I also was still really enjoying epidemiology, but from a perspective of a hobby. I would read books about it and listen to podcasts, but I didn't really see it as anything other than a hobby because before the COVID-19 pandemic, people didn't really know what epi was. And it wasn't super common that people build a career in it, or at least it wasn't to me. So Dr. Downs and Dr. Morris reminded me that I could go to school and study epi if I really wanted to, which is how I ended up at Bloomberg School of Public Health. I went there for my MSPH in International Health, Global Disease Epi and Control. I specifically chose this program because international program because I've been more interested in neglected tropical diseases over non-communicables or domestic style health than just from hobby perspective. And I always had pictured when I started going to school that I would end up doing outbreak investigation. Like the things that you read about in books and that you hear about on the news always seemed so interesting to me. And so when I started at Hopkins, I joined a lab that was studying Chagas disease in Bolivia. And I got to flex my lab skills again, which was a big surprise. I spent like 6 months working with collaborators in Bolivia, developing SOPs and procedures to harvest and grow parasites harvested from people in the hospital, which was really, really rewarding. As a part of my didactic work, though, I was required to take what we call an evaluation class. An evaluation in this context means looking at a health program or a health service in a specific region or a specific field and determining how effective it is at actually achieving its goals. So if your goal is to get vaccines in people's arms, evaluating how well you actually do that and where it's going wrong and where it's going right. I took one class and was hooked from the very first lecture. I ended up taking every evaluation class available at Hopkins, and I got a certificate in international health evaluation just because I loved it so much. And then it came time to pick my field placement to do my capstone and thesis work. And I had the option of studying infectious disease or of doing something non-communicable. And I ended up doing the vast majority of my capstone work in Peru with a non-communicable study because my PI gave me a lot more agency and he was letting me implement an entire clinical trial essentially by myself with one other student. So I was getting to do a lot of the things that I found interesting from my didactic work on the ground in real life and developing those skills. And I knew, experiences they're not one-sided. One experience you can always apply somewhere else. So I figured I could learn to implement a health trial, like a health study, a health trial, and then apply it somewhere else in my career. So in these photos you see in the top left is me and Kate in Puno, which is where we lived for 7 months, implementing Andes, which was a primary care strategy targeting indigenous populations in southern Peru. Next to that photo is a health fair that we set up to recruit field participants and kind of gain trust and community with the locals there. There's just like a silly photo of us during our master's degree. And then the bottom photo you can see Kate in her blue sweater, that is a health facility that we went and ran an assessment of. So that was the evaluation part where we got to go and run checklists and interview doctors, interview midwives and see, what do you need? What are you running out of? How is this working? How is it not working? It's really, really rewarding. We were in Peru for, I think, total 7 months, and we ended up having to leave in part due to political unrest in January of 23. But I do still work on this project, and they are running the main trial now. And this brings us to Nepal, which was my surprise research study. My PI does work in a lot of countries, and I'm the only person on his staff that has any lab experience. So he has a study in Nepal that is interested in macrophage involvement with air pollutants. And so they are trying to run a new type of test, and he needed someone to go and figure out how to collect samples viably. And he didn't have anyone else that could do that. So on a pretty random Tuesday, he called me and asked if I wanted to go to Nepal that weekend. And I said yes, as one does. So this is me in Nepal. I spent about 3 days working with them to figure out the field site procedures, and we did pretty well. We managed to get it done early. And so he told me to spend the next 3 days just sightseeing. And so Nepal is famous for a lot of things, particularly one of them is monkey temples. So in this picture, you can see a monkey. He's just kind of chilling there on the ground, around the stairs. There's only one monkey in this picture, but they were everywhere. And as I was leaving, I made the mistake of holding a Coke bottle in my hand, and a monkey took my Coke bottle. He was on like the railing, and I remember thinking when he clocked me that this wasn't going to end well for me. He jumped onto my shoulder, grabbed my hat, reached for my Coke bottle. I let him grab it, and then he thankfully jumped right off, and it was all fine. Now it's a funny story, but I did have a heart attack on the way down those stairs, but now it's just kind of a funny story. So then I came to graduation, which was a very exciting time. We wrapped up our capstones, all of our thesis work. All of us were feeling kind of simultaneously excited and unsure about what the world had to offer. So in the bottom picture here, 3 of us decided we would jump out of a plane and see if that gave us some catharsis, and it did, but it didn't solve my job problems. But it's very fun. If you are not afraid of heights, I recommend skydiving. So my main struggle with graduation was I was a bit burnt out from academics. I didn't love the structure of working under a professor and having very strict research goals versus like healthcare implementation capacity building goals. Like that was a big thing that I learned in my experience in Peru, is that I was more passionate about capacity building than I was about research for research sake. But I'd only ever worked in academics, so I didn't really know what else was out there, and I wasn't super keen on government. So I had lots of existential crises phone calls with Dr. Downs and Dr. Morris and Marianne Wolf, trying to figure out, what to do, how to adjust my CV, what other areas were available. I must have cold emailed like 40 people at every organization you could possibly think of. And eventually Dr. Downs kept reminding me that I could apply for an ORISE fellowship, which is exactly where I ended up. And I'm very grateful to her for that, but it was kind of a hard realization. But so now I'm an ORISE fellow for the CDC, working at the dengue branch in Puerto Rico. My main focus here is to work on the implementation of a vaccine. And I will 100% be the first to admit that I didn't want to work for the government. I didn't think that it would be the best environment for me, but I've been entirely wrong. I have been here for about a month and I really love it. The main focus of my job is, like I said, we're implementing a vaccine for dengue fever, which is a mosquito-borne illness. It's a pretty hard vaccine to implement, so it takes a lot of, interaction with the Department of Health here. We spend a lot of time in the field talking to providers. We spend a lot of time building trust in the community. But we're doing pretty good, I have to say, and we're starting to get shots in arms, and pretty soon we're going to be bringing it to some other US territories, which is very exciting. Additionally, what's really special to me about working at Dengue Branch is that they really value mentorship. So in this top left photo here, you can see these are all the fellows at the branch. So all of us are kind of early career scientists. We've just come to the branch, and the branch leadership, our branch chief in particular, is very keen to make sure we all get space to work on what we want and develop skills that we want. And so they're very forward and like they really value reflection, which I really appreciate. I also am getting to, because CDC Dengue Branch is the only CDC branch that is an authority on dengue fever, I get to work on any dengue outbreak all over the world if they seek our attention or our help. So I've worked on dengue outbreaks in Peru, in Bangladesh, US Virgin Islands, and there's a couple of cases in California that we're advising on. I also get to do some field work involving the mosquitoes. So in these bottom pictures you see, we're looking for mosquito larvae in the communities to try and help generate knowledge and acceptance of our work, which is really fun and really exciting. And I know all of that sounds like a straight line when I say it like that, like everything led directly to the next one, but this is how it felt. A lot of the time I've had no idea what I was doing and I felt like I was going backwards. I didn't know some of these options existed when I started them. When I started at MSU, I wanted to be an MD. I didn't know that I would love research. And then I loved research for about 4 years and realized it wasn't for me anymore. But now I'm doing something that I find really, really exciting, and it's a far cry from being an MD, but I think it's a great spot for me. And so as I kind of wrap up here, I just have a couple of things that I really have learned, that I've learned along the way, and that I wished somebody would have told me when I was a senior at State or even younger. And the first one is that I hope you guys will all stay curious. Go where you're interested and follow that. Like, follow your passions. You'll never regret an opportunity. The worst that happens is you learn something about the experience or about yourself. And kind of along those lines, trust yourself. I think it was Dr. Thorne at BLD who once told me, no one will ever give you an opportunity they don't think you can succeed at. And that's especially true in your career, because nobody ever wants to see you fail. They want you to succeed on their behalf. Imposter syndrome is super real. And most of the time, I didn't think I was qualified for half of what I was doing, but we always got there. Maybe not the most elegantly, but we always figured it out, and you come out better on the other side. And that is really easy to lose sight of. And I really hope that you guys never lose that trust in yourself and that belief. And then also, like, the third thing I would say is reflect regularly. This whole story is about how my interests and passions have changed and how I've adapted and reacted to them. And that's okay. Like, what you want professionally, personally, is going to change, and that's super normal, and it's really scary sometimes, but it's more important to live authentically and seek fulfillment instead of ambition, I think. And perhaps most importantly, and the whole point of these talks, I think, is to build connections. Networking is really important, but I think mentorship is even more important. You know, you can have a networking connection, but mentors you'll lean on for your whole lives. I met Dr. Downs and Dr. Morris almost 10 years ago now, and they still answer the phone every time I'm having an existential crisis, or they still text me to check in and just see how work's going. And I find that so valuable, and they've taught me so much. So I encourage you all to reach out to people that you admire and respect, and people that, you know, you would like live by their example, and just seek out their guidance and their help. And so that's pretty much all I have to say. I hope all of you continue to seek things that give you inspiration. I promise you'll find things that you could have never imagined and that are really incredible. And I do hope you skip the monkey, but if you do, it's a pretty funny story. So here's just a quick slide with some of the fun things that I've gotten to do when I wasn't working, because I've gotten to work at some really cool places, and it's also got all of my contact info. So please feel free to reach out. I'm happy to chat, or connect on LinkedIn or anything you guys need. And that's my whole talk.
All right. Thank you so much, Parker. That was a wonderful presentation. Definitely learned a lot. And I'm sure a lot of you guys have some questions. So if anyone has some questions in the chat, or you're welcome to enter it in the chat, or if you want to just unmute yourself, whatever you prefer. I can start off with a few questions. Oh, it looks like someone
I
asked,
can definitely do
yeah,
that.
if you want to just share it while we're asking questions, you can leave it on that slide if you'd like.
You got it.
That
You
is
got to see my little script. I apologize.
perfect.
Okay.
The monkey story is so funny.
Yeah, that's, I think, Dr. Morris's favorite story of my whole career.
I believe it. Okay, let's see. I know you talked about this a little bit. Let's see, what aspect of your BLD training has been most beneficial in your professional career?
Yes. So I talked to Paul about this, I think, a bit ago, but I think one thing that I valued a lot about BLD, and specifically, was that they had a focus on learning fundamentals and understanding mechanics, because you can parrot back information and that's great, but if something goes wrong, you being able to parrot back information is not going to help. So I think the like hands-on learning and spending time understanding a laboratory assay is really important, because when it goes wrong, you can fix it. And that gives you so much agency and so much power. There are so many people in the world who don't have that kind of agency. And when I say agency, I mean that kind of like confidence and that kind of ability. So I think that's a really big benefit. Yeah, I think that would be the main thing.
Anybody else have any questions that they'd like to ask? If not, I do have one more. People are still thinking. Let's see.
I do have one.
Oh, go ahead.
So hey, my name is Lady Rodriguez Torres. I'm from Puerto Rico.
Amazing.
And I do know I know you mentioned that that you work at the dengue like agency specifically in epidemics. But I do also know that right now there's an epidemic of influenza, right, in Puerto Rico. So
Yeah.
can you talk to us a little bit about that?
Yeah, definitely. So there is an ongoing epidemic of influenza here in Puerto Rico. CDC, as the only CDC branch on the island, we do respond to all public health crises here on the island. PRDH, which is the Department of Public Health here in Puerto Rico, is managing the epidemic primarily, because we play more of a supportive role, because we don't it's a part of capacity building that we would rather the local government is able to handle it and we support versus we supplant them entirely. So what we're doing to support them is we're providing staff. So we've got some epidemic surveillance officers over at PRDH helping them with their data management. I'm doing a lot of surveillance. So surveillance just means that I'm monitoring hospitals and taking record of how many people are coming in with flu, what are their outcomes, what's their severity, is contact tracing to figure out where they might have caught it. And then we do a bit of case management as well. So if we have really severe cases, we do follow up with them and we provide kind of secondary testing and secondary care if needed. Does that answer your question?
Yeah, thank you so much. And I do have another question. I don't know how to word it,
No
but
worries.
I do know that in Puerto Rico also, you get like power break, it's outbreaks, I think it is. I don't know how to say it in English, but like,
Or you can tell me in Spanish.
like, okay, como que se va mucho el agua y la luz. And
Uh-huh.
then like las personas tienen cisternas, so like con el dengue yo sé que viene con, porque es un mosquito y se puede atraer a través de las cisternas.
Yeah. So
So, eso, que si puedes dar más información de eso. My bad.
yeah, no, so she's asking about power outages and that a lot of people, when they lose power here, they also lose water. And so they use cisterns for water. And that dengue is a mosquito-borne disease. It comes from a type of mosquito called Aedes aegypti, which is specifically, or not specifically, especially evolved, I'll say, for urban lifestyles. They like little containers of water like cisterns or tires and things like that. So it is a big issue, and I don't work directly on the community outreach for arboviral protection. That's actually largely done by PRDH. Again, we provide a supportive role on that one, but when the power goes out, it does create an issue. We do worry a lot about dengue, like mosquito breeding, creating pockets of dengue. And we have, particularly in Ponce, which is on the south side of the island, and now here in San Juan, we have community outreach surveillance programs where we offer a service that if you call the line, if you say, hey, I've noticed there's a lot of mosquitoes in my area for whatever reason, could be because the power went out last week and everyone was relying on water, we'll come and do patio inspections, and we will inspect any house in a neighborhood that gives us permission to look for breeding areas for mosquitoes, and then provide people with larvicide if they need it, just on that occasion, and then teach them how to do their own patio inspections so they're not so reliant on us coming to do it, and they can kind of take charge of their own surveillance that way.
Thank you so much.
Yeah, of course.
I do have a question. So obviously you've moved around a ton from Michigan to I think Johns Hopkins in Maryland.
It is, yeah.
Okay, and then all around the world and stuff. So I was just curious, like, how do you deal with moving around and being at so many new places and just having to pretty much restart like friendships, and also how how work life is starting new all the time, and like, do you have any advice, anything that you'd like to share about that?
Yeah, it's a really important question, and one that I wish people ask me more often, because I think people underestimate like how difficult it can be to move. I'm actually not even from Michigan. Like, I moved to Michigan for state. I'm from California. So I have done it a lot, and part of the reason I actually chose Puerto Rico was because it was the closest of all of my options. I think my other options were Panama and Peru. So this was actually the closest option I had, and it's difficult starting over, like you pointed out, I think, and I think college is like a really similar time. Like, it's important to invest in community, to get out and get involved in something, find something you really enjoy. And so I have really found luck in everywhere that I've gone, I volunteer, because partially selfishly, because I grew up speaking Spanish and I was concerned I'd lose that living in Michigan and in Maryland. So I volunteered with Spanish speaking organizations. But it's also just a really good way to meet people who are like-minded and maybe have other interests you share in common. And it helps when you move somewhere for like a job or for school, because you have people around you that are doing similar things, and often a lot of them have moved as well. When I came here, to Puerto Rico, I was like the only person that moved here. So nobody else was figuring it out, which was a bit difficult. But like I said, like I found a volunteer opportunity, and the other fellows are very kind and they are very helpful. So I think it's partially just like putting yourself out there and like making time and investing in new experiences. And then it's also, oh shoot, I had a thought, now it's gone. Happens to us all, you guys. Yeah, it's making time for that. And then it's also, you know what, it's gonna come to me in like 5 minutes.
Oh no, it's no problem. That happens to me all the time. But thank you. I think, yeah, I think definitely moving is great. Like all that in such a short amount of time too can be difficult, but I mean, it seems totally worth it and totally open your horizon.
Yeah. And I guess I'll go back to kind of one of my main points that I wanted to leave everybody with is the reflection piece of it's really important, because when I went to Peru, I was convinced that like I was going to move to a different country every year, because part of the reason I got international health is because I love traveling and I wanted to travel. Living in Puno for 7 months is really hard. Even though I speak Spanish, you know, it's very easy to be othered because you don't look like people around you, which everyone knows is a thing. The culture shock is difficult. And then it's hard to build relationships when you know that you're going to be leaving. And so it was hard for me to kind of really connect with my coworkers and with people in my town, because I knew in, you know, a year I'm leaving, and it ended up being shorter because we had to leave earlier. And that was really difficult. So when I was looking for a job and like trying to figure out what my next move was, a big part of my decision was realizing that I want somewhere that I can build a lasting community. And so I was only looking at jobs that were going to be like minimum 3 years. I was like, I don't want to have to move again. I don't want to have to worry about making new friends again. And that's a very real thing that I think gets, like, living abroad and doing all of the moving gets romanticized, and it is really great and I love it and I wouldn't trade it for the world, but it is something that I think you have to be really honest with yourself about. Is this what I want? Am I capable of handling that? Because I realized in Peru that maybe not as much as I thought.
Thank you so much. That was a lot of that was like helpful information.
Yeah.
Is anyone else have any questions that they'd like to ask? Oh, looks like there is one in the chat. Celeste asks, once this vaccination is fully developed, have there been any other vaccine/health development you have been interested in that you can use your BLD experience in?
Yes. This is like gonna be a little bit of vague. So I think you could take that BLD experience and use it in a lot of ways. Like, I'm obviously not doing lab work anymore. In a way, the way that the dengue vaccine works is it requires a pre-vaccination screening, and part of the issue we're having with implementing it is figuring out ways of making that screening accessible and cost effective for people. And the lab background has really helped me with that, because I understand the logistics and like what needs to be done, and like I understand like positive predictive value and those things that not everybody else does, which is a great benefit from BLD. But along these lines, I really am passionate about capacity building, and I don't know if anybody here is familiar with APHL, which I always screw up the name, but it's American Public Health Laboratories, or the Association Public Health Laboratories. Marianne Wolf works for them. I highly recommend everybody reach out to her. But they have a global health unit who, their whole thing is they capacity build laboratory strength around the world. And I was considering a job with them before I took this one. And they go to they have country regions or world regions, and they go and assess laboratory capacity and help figure out funding and training means of getting testing to where it needs to be for all kinds of things. So I know Dr. Down still works for them. She runs trainings in parts of Africa and I think Asia, to just improve their capacity and make testing more accessible, to make healthcare accessible to people all around the world. I think that that's somewhere I could see myself ending up in a couple of years when I'm more ready for a higher level position. But right now, I really love the field work. I like going to hospitals and going to visit communities and figuring out what is on the demand side versus the access side, if that makes sense. I hope that answered your question. Great.
Okay. If you guys just want to keep asking questions in the chat, that is totally fine too. I have one more question from a student. What is something you wish you knew during your undergrad years?
What is
Sorry,
something?
kind of
No, that's fine. Something I wish I knew during my undergrad years. I think I tried to get this across. I think I wish that how do I say this? I wish that I knew that there was more out there than I was even picturing, because like I said, I'm not doing something that I knew existed. And so I wish that I hadn't had such tunnel vision, because when I started to realize that I didn't want to be a doctor, I was really distraught, and like it was a big part of my identity. And I wish someone had just told me like, hey, that's okay, and like you're allowed to change your mind. And I think that I severely undervalued mentorship when I was an undergrad. And that's why I really encourage all of you guys to try and build connections that are meaningful. And it has to be a lot of them. It can be one, it could be with another student, it could be with another professor, who knows. But that is something that as an adult and as a grad student, I relied on a lot. And I remember thinking I should have done that as an undergrad, because you get so much valuable information and help from people who've already lived it. And that's really invaluable. Anybody else?
I have one more question. So I know you were pre-med in undergrad, and as you mentioned, so did you have like and you fell in love with research basically? That's kind of changed your mind. And did you have any regrets, or were you like really nervous about making a different choice? Because I know that's like you mentioned you did have that tunnel vision, and like what was your kind of thought process, and like what year were you when you kind of decided to switch that?
I think I was probably a junior when I started to realize I didn't actually want to be an MD. And I will fully blame Dr. Downs, because she introduced me to epidemiology. And I had worked in hospitals previously in LA. I was a medical translator in an ER, and I always wanted to be an ER doc, and I loved it. And then I went back to it when I went home for the summer and realized I don't actually like the medicine part. I like the disease part, which sounds really bad, but every epidemiologist ever will probably tell you the same thing. Just the mechanism of the actual disease was more interesting to me, and like the determinants of health, and like how that person gets sick, and like what determines recovery, and kind of every facet was much more interesting to me. And that wasn't vocabulary that I had when I was younger. I didn't know that it existed, which again sounds crazy now, because I feel like everyone knows what epidemiology is after the COVID pandemic. But the first time I heard it was at State. And then when I told my parents I was getting a degree in epi, they were like, what's that? Like, why would you study that? And then ironically, the pandemic hit a year later, and they were like, oh, okay, we get it. But when I had that realization, I freaked out. Because I had spent my whole life thinking my life was going to go one way, and then all of a sudden I didn't want that anymore, and that was really scary. I was like, if I was a junior, I think I was like 19 or 20. Like that's, I make myself sound so old, but like that's really young, and like I didn't know that there was a big beautiful world out there that I wanted to see and do, and there were other options. And again, like this all sounds like it makes so much sense. Like everything had a step-by-step logical progression, but most of the time I had no idea what I was doing, and I was flying by the seat of my pants and just trying to go where I thought I would be happy. I had people in my life that were really adamant that I stick to what I was interested in, and that what I'm passionate about, and that I could change my mind. And that's what I did, but it was scary the whole time. But I'll encourage everyone to do that, and to find people who will encourage you to seek out the thing that you're passionate in, because it's going to change, and that's okay. I hope that answered your question, Misha.
Oh, definitely. Thank you. It's definitely, yeah. BLD definitely opens your mind to a lot of different paths. So
I see some questions in the chat. So Sydney Kramer asked, how do you balance work life and life outside of work? How do you balance stress? This is a great question. And this is partially why I left academia, because in my experience, academia has a very hard time balancing work with work-life balance. And it is something that I have prioritized throughout my career, and probably partially why I'm not a doctor. Work-life balance is really important to me. I like to turn my laptop off and put my work phone away when I get home. I do work in a field where I am required to be on call sometimes, and that's fine. I sign up for it, but when I'm not on call, I'm not on call. And it's also like a really high stress work. Like Letty might mentioned, like we're in a flu epidemic, and that's really stressful. I had to spend Saturday on call, like going to a hospital. And you know that there are people depending on you, and that is really stressful. But I personally find a lot of like stress relief from exercise and from like taking walks outside and trying to build that into my schedule. Like I put like a 30-minute window into my calendar that says I'm busy and you can't bother me, and it's just for me to take a walk. And that's things like strategies that I've learned throughout my career. Like that's what I need to do to keep myself sane. Other people don't need that. It really is kind of, again, a lot of reflection and introspection and trial and error to figure out what works. I have some friends who like every 5 minutes have to walk away from their desk. I don't have to do that, but I need a 30-minute walk every day at lunch. And that's just kind of helps me get through that. And again, I think a lot of it comes from like building connections and relationships. Like I've talked with Dr. Downs in particular a lot because she's worked in global health as well. And sometimes it can feel really overwhelming, kind of the difference that you're trying to make. And it often feels like the world's working against you. And that can be really like disheartening. Like when I left Peru because of political unrest, like that was really disheartening because we worked really, really hard to bring healthcare to a really neglected group. And in like a week, all of that work was gone and we were forced to leave. And that was really, really hard. And you just have to learn to roll with it and work with what you have and lean on the people next to you. And thankfully we were able to get back to a position where we're giving them healthcare again, but that was really, really difficult. And, you know, not a thing that I thought I'd have to deal with in my life, but was really eye-opening about who I am as a person. I hope that answered your question, Sydney. Shall I move on to the next one?
Yeah.
So, oh great, thank you, Sydney. So the next question is from Yukari. If there'll be a permanent position there for me after I finish my fellowship, or do I want to stay there, or do you want to see a different place? This is a great question. I have no idea. And I have no idea because everything that I've thought I was going to do in my life, I didn't end up doing. So I really love where I am right now. I've been here about 4 weeks, so it's very new. The position's great. I really enjoy who I work with, but I acknowledge that 3 years from now, I could want different things. The job could have changed. I am very likely to discover something through this work that I didn't know existed and think, hey, that's really cool. I want to go do that now. So I don't know. I think the likelihood that there is a position is quite high because just that's the trajectory of most fellows is like there's turnover and people get hired in and they leave. I really love living in Puerto Rico, but I've lived here for a month. So, you know, I don't think that'll change, but we'll see. But the honest answer to that question is I have no idea. I would love to see somewhere new, but I don't have to live somewhere new to see somewhere new. That's the beauty of airplanes. But yeah, that is something I think about often and I reflect on a lot. I don't see any more questions in the chat unless somebody wants to ask something.
Yeah, I don't see any more.
I'm sorry. I wanted to ask.
Oh,
Sorry,
go ahead, go ahead.
No, don't apologize. That's what I'm here for.
Oh, I just wanted to ask, like, what has been your favorite memory in Puerto Rico, or like, what places have you visited that have like, you've liked?
Well, I've only been in Puerto Rico for a month, like I said. I did go to Cabo Rojo for the first time last weekend. That was pretty amazing. I'm super partial to Peru because I lived there for so long. I got to see a lot of that country. I got to know it really intimately because I worked with the Ministry of Health really closely. We did a lot of capacity building while I was there, which was great. And because I was there for so long, I got to see a lot of the country, and like my weekends were my weekends, and we got to do just some really amazing things. I haven't done Nepal is the only place in Asia that I've worked, but I've traveled in Asia a decent amount, and I would really love to go back. I think the like juxtaposition of Eastern and Western culture is really beautiful, and like I've learned a lot just about people being there. There's very few places in the world I would not work. Actually, I think there are no places in the world I would not work. If the opportunity arose, I'd be happy to help anywhere where I thought I was useful to work. And I'll qualify that by saying where I think I'm useful. Like I don't think like there's potentially a dengue outbreak happening in a French-speaking country, and I'm not the most useful person to go to that place because I don't speak French. Would I love to go visit it? Yes, of course, but I do think that that is something in international health in particular that you need to be really honest and aware of, like where your skills are needed and where you are the most effective, especially where there are local people that are able to do the job just as well, which is again why we do a lot of our work is in support of PRDH instead of PRDH. I got a bit off on a tangent there, but I hope that answered your question. I did really love doing the Inca Trail in Peru. I would recommend that. That was pretty amazing.
Thank you. Oh, yeah, she answered in the chat. Okay. If I think that's the end of questions. Parker, if there's anything left that you'd like to say, I know you've been talking for 45 minutes, but I don't know. Anything else you'd like to mention?
Not particularly. I would just again like if anything I've said you're interested in the work or the not work, please shoot me an email. Give me like 48 hours to respond because like I said, I'm living through a flu epidemic right now. But I'm happy to chat or listen or anything. Like I found that valuable as a student, and if I can pay that forward, I'd really like to. So if anything resonated with you, please like never hesitate to reach out.
Okay, thank you so much. It was honestly a great presentation, and I enjoyed at least learning about everything, and I'm sure everybody else did. It was I don't think we've had a speaker that's had so much experience in many different things, and also coming from Michigan State, and we appreciate you spending your time with us this evening. And then Paige, I don't know if you want to say anything else, but that's all.
No,
for
I mean, you covered a lot of it. Once again, I think this was a fantastic presentation. Thank you so much for taking time out of your very busy and flu-ridden schedule.
Thanks.
Just as a reminder for this is going to be posted on the BLD website under our speaker series. Parker's contact information is, I mean, it's throughout the majority of the presentation, and we will also probably just post it on the website as well. I don't really have a whole lot other than to say thank you.